My name is Yingrong Zhu. I am a physician in physical medicine and rehabilitation. I subspecialize in cancer rehabilitation. Additionally, I am licensed in medical acupuncture in the state of New York, and I do it as part of my medical practice in treating cancer patients. I'm very excited to speak with everyone tonight about how acupuncture can be helpful in cancer rehabilitation. And so we'll kind of do an overview of what it entails, and I'll be talking about some additional information regarding acupuncture. So let's begin by discussing what is acupuncture. So acupuncture comes from the practice of traditional Chinese medicine, which is based on thousands of years of observation by Chinese medical practitioners. It involves the placement of needles into certain points of the human body known as acupuncture points. It's believed that these special points are connected through channels called meridians, and that placement of needles into these points can help rebalance the energy of the body, remove any blockages in energy of the body, and promote overall well-being. So this is a definition of acupuncture from Johns Hopkins Medicine, where they kind of talk about the traditional Chinese medicine theory behind acupuncture. Now, when it comes to Western medicine theory, a lot of research has been done into exactly how or why acupuncture works. There's a few different theories, including promotion of secretion of beneficial neuroendocrine hormones, as well as helping with pain through something called cake control theory. But there's really no, theory to kind of tie everything together. So this is something we're still investigating from a Western medicine standpoint of how and why it works. Now, what does it look like when you actually get acupuncture? So these are a few images. If we start in the top left corner. So acupuncture needles are packaged serially in their own individual packages. These are FDA regulated. So, they're sterile just as any needle would be for like a blood draw, for instance. However, the needles used for acupuncture are hair thin. They're much, much thinner than any blood draw needles or other needles that you may be familiar with on the market. In addition to the needle, they typically come packaged in a guide tube. So the needle is in the middle and there's a plastic tube around it. The acupuncture practitioner will put the needle and the guide tube onto the acupoint that they're stimulating. And then they will break the seal between these two, the points between the needle and the tube. And they will use their finger to press the needle in. Once the needle is kind of in the correct location, they will then remove the guide tube and use their fingers to help direct the needle further down until it's at the correct depth. A question I often get from patients is whether or not this is painful. The answer is actually it's not painful at all. It's very, like I said earlier, it's a very thin needle. The sensation that patients sometimes do describe themselves feeling when the needle goes into the acupuncture point is more of a deep ache or like a shooting electrical sensation. And those are actually indications that the needle is in the correct acupuncture point. Because if you just put this needle in any random point, you will not get those sensations. So I would say it's typically not uncomfortable, and that sensation patients get usually is only right when the needle first goes into the point and actually will subside over time. There are some times where, if I'm doing acupuncture on someone's back and the patient isn't seeing it, once I finish putting all the needles in, I'll say, okay, all the needles are in, we're going to leave them in for X amount of time. And they say, oh, I didn't feel anything. And that happens sometimes too. So we'll talk a little bit more now about the symptoms and the conditions that acupuncture can be helpful for. So according to the National Center for Complementary and Integrative Health, acupuncture is really helpful for a lot of different pain symptoms. You can use it for back or neck pain, osteoarthritis, which is age-related wear and tear on different joints of the body, headache and migraine, myofascial pain, which is pain that comes from the muscles. For example, when you feel like your muscles are really tight and bunched up and you press down those muscles and you feel, like there's pain in that area, that's what myofascial pain is. Sciatica, which is the shooting pain that patients sometimes get down the back of their buttocks, shooting down to their legs and their feet. Post-operative pain, so pain from after having a surgery. Aromatase inhibitor-induced arthralgia, so those are for our breast cancer patients who are on like a letrozole or anastrozole and then have joint pains as a side effect. and cancer pain. So pain that comes directly from the cancer being in the body. It can also be helpful for non-pain conditions such as seasonal allergies, urinary incontinence, which is when you have trouble holding your urine, and cancer treatment related nausea, vomiting, whether that's before chemo, after chemo, or related to something else, as well as hot flashes. It can also be helpful for certain cancer specific conditions. So these conditions include chemotherapy induced peripheral neuropathy, which is that burning, tingling, numbness you get in your fingers and your toes during or after you have chemotherapy, chemotherapy induced nausea, vomiting, cancer related fatigue. So cancer related fatigue is when you just like feel completely wiped out, either when you're undergoing cancer treatment or after you've done cancer treatment, and where even small day-to-day activities can make you just feel completely exhausted. Again, the aromatase inhibitor induced arthralgias, cancer pain, brain fog, sometimes known as chemo brain. So patients describe this kind of like feeling like they're not as sharp as they are before, or feeling scatterbrain, or feeling like their short-term memory is just not what it used to be. Um, this acupuncture can be helpful for these conditions. And then leukopenia, a big one for a cancer patient. So that's when your white blood cell counts are very low. So the white blood cells are part of our immune system. They're really important for helping our bodies fight infections, whether it's bacterial or viral. So when you hear your oncologist tell you to wear a mask when you go out and wash your hands frequently and avoid crowded places because you're immunocompromised, one of the reasons why your oncologist says that is because your white blood cell counts are low. So you don't have the body's natural defense system to fight an infection compared to someone who has a higher number of white blood cells. And again, hot flashes for our breast cancer and prostate cancer patients for undergoing the treatments that help diminish their hormones. There is medical Western medicine evidence behind acupuncture interventions as well. There's been a lot of different studies that have been done, just like with any treatment that we recommend for our patients, where they look at patients who had the interventions and patients who did not, and they actually compare the two groups to see if there was a benefit to the medical intervention that was offered. So we'll go through a few of them. So there is an article titled "The Value of Acupuncture in Cancer Care," published by Liu et al. In 2008, where they looked at a lot of studies that were out and had been published on acupuncture in cancer patients, and they aggregated the studies to look to see what the overall trends in were and how functional it was and what conditions it helped with. And they found when reviewing these studies that it was helpful for chemotherapy-induced nausea and vomiting, for cancer pain, post-operative pain, post-thoracotomy wound pain. So thoracotomy is a surgery that some lung cancer patients go through, where the surgeon goes through the rib and opens up the rib to take out a piece of the lung that has disease in it. So that procedure, of course, you can imagine is very painful, and they found acupuncture was helpful for this type of pain. Hot flashes again for our breast cancer or prostate cancer patients, chemotherapy-induced leukopenia, that low white blood cell count that makes you immunocompromised that we talked about already, post-chemotherapy fatigue, and radiation-induced xerostomia. So xerostomia is dry mouth. This can happen very frequently with our head and neck cancer patients who've gone through radiation treatment to kill the cancer in that area. Of course, a lot of other structures that are in that area, for example, the salivary glands get damaged as well. And as a result, these patients have dry mouth because their salivary glands are not working as well. It's another study from 2021 titled Systematic Review with Meta-Analyses, Effectiveness and Safety of Acupuncture as Adjuvant Therapy for Side Effects Management in Drug Therapy Receiving Breast Cancer Patients, published by Chan et al. So this study was specifically looking at published studies, including breast cancer patients, to see if acupuncture was helpful for them. But not only did they look to see if the acupuncture was effective, they also looked to see if it was safe. So on the safety standpoint, it was very safe. There's really only very minor side effects when they occur. So things like minor bruising, things like that. Definitely nothing dangerous or concerning that happened to any of the patients as a result of undergoing acupuncture treatment. The conditions they found that acupuncture was helpful for in breast cancer patients, based on the literature search they did of looking up currently published studies at this time, they found it was helpful for nausea and vomiting, for stimulating appetite, for both constipation and diarrhea. They also found it was useful for chemotherapy-induced peripheral neuropathy. Again, those tingling in the fingers and the toes, or pain or burning in the hands and the feet that you can feel after undergoing chemotherapy. The aromatase inhibitor associated joint symptoms. So our patients with joint pain because they're on anastrozole or letrozole or exemestane, and cognitive impairment. So again, the patients who felt like they were not as sharp as before, or their memory wasn't as good, or conditions like that. There's another study from 2015 titled Effectiveness of Acupuncture-Related Therapies for Palliative Care of Cancer over Systemic Reviews by Wu et al., where the authors looked again at research that was already published specifically for helping the symptoms that cancer patients were undergoing. And, it's a lot of the same as the previous studies. They found it was helpful for cancer-related fatigue, for hot flashes, for the low white blood cell counts, and for dry mouth. And another similar study in 2016, again, that they found acupuncture was very helpful for pain and for fatigue. So, if we were to go through all the different studies that have been done in acupuncture, even in cancer patients, there would be an endless list, but these are kind of like a few of the larger studies that have been done for us to kind of look at the, evidence behind these treatments. They've also looked to see if acupuncture stimulation could be helpful for anxiety, depression in cancer patients. And again, this is another study where they looked at aggregated other studies that have been published before this point to look at the overall trends. And again, they found that it was helpful for anxiety and depression. But not just that, the study also looked at stimulation through acupressure. So what acupressure is the acupuncture points we talked about. In addition to putting needles in them, you can also stimulate them by pressing down on those points. So when you do that, it's called acupressure because you're using pressure instead of a needle, which is the puncture part of the acupuncture. And acupressure can be very helpful for treatment of different conditions as well. Typically speaking, the effects are maybe not as strong and don't last as long as opposed to putting needle in, because we're able to get deeper into the point. But there are definitely things that you can do on yourself that can be helpful to help control your symptoms as well. So, acupuncture, we've talked about how it's really helpful for all these things, but it's not great for everyone. And there are certain conditions where we actually do not recommend using acupuncture, or we recommend exercising caution when using acupuncture. So those conditions are in pregnancy. There's certain points that are not recommended for use because those points can actually lead to contractions, right? So if we have someone who's early on their pregnancy, we definitely don't want baby coming out yet. So, that's the reason why that's contraindicated. And acupuncture actually has also been used to induce pregnancy in women whose pregnancies have gone on longer than they or their doctors have wanted them to go on. But the evidence is kind of mixed about whether or not that works, but still those points are not recommended in patients who are pregnant. It's also not recommended to do acupuncture in patients with uncontrolled movements. So you can imagine these points are very discrete points on the body, and we have to be very careful when putting the needle into those points to make sure we're in the perfect place and that we're not going somewhere we shouldn't be going with a needle. So the patient is not able to control their movements or control, how they're holding themselves. That can be dangerous because the needle might go somewhere where it shouldn't be going. So, that's one of the reasons why those patients should not be getting acupuncture. Lymphedema, we don't recommend acupuncture to any limb with lymphedema. So just like your doctors tell you, like, don't let them do blood draws on the limb with your lymphedema, or don't let them do blood pressures on there. Same thing, like acupuncture should not be done on the limbs with lymphedema. My caveat is, there's different types of acupuncture, and you don't necessarily have to put the needle into a point on the limb where the symptoms are. So even if, for example, we're treating your left arm, you have lymphedema on the left arm, I could treat your left arm using a needle on the ear, for instance. So, it doesn't mean you can't get acupuncture, just the acupuncture should not be putting a needle directly into the limb where you have lymphedema. Spinal instability is another case where we do not recommend doing acupuncture. And the reason for this is so the spine is normally, a series of bones stacked on each other, kind of where you can see here. But that's not the only thing keeping it upright. There's also muscles surrounding this area that helps with the spine stability. So in cases where the spinal instability is present, the bones themselves are not aligned properly, and the muscles are really doing the lion's share of work in keeping that spine from collapsing or from, turning a certain direction that it shouldn't be. And in acupuncture, muscles can become very relaxed as a result of acupuncture treatment. So we do not want to relax those muscles and as a result, take away the only thing keeping the spine stable in that area. We also don't recommend acupuncture in cases of very low platelet counts. So platelets are another cell in your blood. Their main purpose is to help you clot. So, if we get cuts or things like that, usually if we bleed for a little bit and then a clot forms, we get a scab and then that kind of blocks off the blood from being able to, flow out more. So in patients who have very low platelet counts, they're more prone to bleeding because those platelets, they don't have enough for them to be doing their job to stop bleeding. So of course, we don't want to cause any kind of trauma or injury to the body that could lead to additional bleeding since they're not able to stop the bleeding internally. We also do not recommend acupuncture in cases where active infection in a limb. So for example, if you have a cellulitis in that limb, definitely do not get acupuncture in there, right? The body's already working hard to fight the infection in that area. We don't want to put in a sharp object that's helping spread around the infection to like a different part of the body. In cases of severe neutropenia, acupuncture is also not recommended. So, neutropenia is another type of low white blood cell count. We talked a little bit earlier about how acupuncture can actually be helpful in helping raise your white blood cell counts if they're low to help, boost up your immune system. However, in cases where the white blood cell count is extremely, extremely low, we don't recommend acupuncture just because no one has studied the safety profile. So in the studies where people looked to see if it was helpful for the low white blood cell count, they looked at patients who had low white blood cell count that was moderate to mild. No one looked at patients who had severe white blood cell counts. So, it's not that guaranteed that this is a risk or dangerous. It's a theoretical risk, but, if we haven't proved that it's safe for these types of patients who are already so fragile, we definitely don't want to recommend it and accidentally do harm instead of helping the patient. And in cases of patients with pacemakers, electrical acupuncture is recommended against. So electroacupuncture is acupuncture where you actually connect electrodes to two different needle sites and you do electrical stimulation. That stimulation is actually able to pass through the channels we talked about earlier, the meridians that connect the different acupuncture points and kind of help circulate energy through the body. In cases of pacemakers, the pacemaker works because the pacemaker is sending electrical signals to the heart to keep the heart beating correctly. So we don't want to introduce any other electrical signals into the body that's going to interfere with the work of the pacemaker. But this is kind of the main list of main contraindications for acupuncture. So now that we've talked about the things we can be helpful for and the cases where we shouldn't do acupuncture, let's talk about, how can we get acupuncture, right? Is this something insurance covers? Obviously there's a lot of financial toxicity associated with cancer diagnosis, cancer treatment. So we always want to see if insurance can help us out by covering some of these treatments. So let's start with Medicare. Medicare is the largest insurer in the United States. All of our patients above 65 and some other patients who have certain medical conditions qualify for Medicare. Unfortunately, Medicare only covers for one diagnosis for acupuncture, and that diagnosis is chronic low back pain, which they define as someone who's had low back pain for, I believe, 12 months. And they will actually cover your acupuncture, up to 12 acupuncture visits right off the bat in 90 days. And if you're showing improvement with your chronic low back pain with the acupuncture visits, they'll give you an additional 8 sessions. So there's a limit of maximum 20 sessions in a calendar year for low back pain for acupuncture from the Medicare side. So you get 12, everyone gets a trial of 12 for their low back pain, and then plus or minus 8 more, depending on how you're doing. Some of the private insurance companies cover a few more diagnoses for acupuncture. So this is just an example. Certain Cigna products will cover a few other diagnoses. They'll cover tension type headaches, such as migraine with or without aura. They'll also cover tension type headaches, which is a headache you get in like one part of your head, and that's like very throbbing, very uncomfortable. They'll cover pretty much any kind of joint pain. So hips, knees, backs, neck, so on and so forth. They'll also cover nausea associated with pregnancy. So remember, we said we have to be very careful if we're doing acupuncture in pregnant patients. So the practitioner needs to know which points to avoid. They'll also cover in cases of post-surgical nausea, only if they're also doing medical management, so for example, medications and things like that. And they'll also cover nausea associated with chemotherapy. And then the other private health insurance company will again cover for a lot of different types of musculoskeletal pain, so joint pains like neck pain, back pain. They will also cover for a headache, and they will cover for nausea pregnancy. They also cover for chemotherapy-induced nausea and vomiting, but they have a few additional coverage diagnoses, which is post-operative dental pain and also temporal mandibular disorders, otherwise known as TMJ symptoms, so or TMJ syndrome. So that's when you have like the locking in your jaw, pain in your jaw, like trouble chewing, things like that, all from like jaw tightness or jaw pain and anything kind of in that area. And this is by no means an exhaustive list of insurances that are out there. There's many, many more insurance companies than this. I just kind of pulled a few examples to kind of give everyone an idea of what they do cover. There are also insurance companies that don't cover any diagnosis for acupuncture. For example, Medicaid does not cover any diagnosis for acupuncture. And we've looked at the evidence. There's a lot of evidence out there that acupuncture does work. So the insurance companies still have some catching up to do when it comes to covering the treatments that are going to help their patients. So now that we talked about all this, are you ready to try some acupressure? So, remember earlier we talked about we can also use pressure to treat some symptoms by pressing on the acupuncture points. So this can be helpful as something to do for yourself when you're having certain symptoms. It's quick and easy, and there's really no side effects from doing acupressure. So it's very safe, doesn't interact with any of your other medications. So the point we're going to do today is called LI4. It is right here. If you look at the back of your hand, between the index finger and the thumb, if you hold it like this, it kind of makes a V. This point is if you slide your finger from the bottom of the V and go down a little bit, you start to feel a divot. That's where the point is. So this point can be helpful for headaches, especially migraines. So if you feel a headache coming on, this is a good point for you. For all sorts of pain, for constipation, diarrhea, hangover, and anxiety. And if you're pregnant, do not press on this point. This is one of those points we do not recommend in pregnancy because it can cause contractions. So the technique is, once you go down at the bottom, again, thumb, index finger, make the V, find the bottom of the V, slide your finger down. You're going to find that divot right there before you feel your bone. And the technique is you're going to take your index finger and your thumb from your other hand. You're going to make like a C, like a claw shape, and you're going to press down on the point. So if you're pressing down hard, and if you're in the right spot, you should start to feel an ache. And the point might feel to you like it's painful, like there's a deep ache when you press down on this point. That's how you know you're pressing the right spot. So in terms of how long you should keep pressure on this point, it's, there's no specified amount of time, right? So normally, if you feel a headache coming on, you just kind of massage it until you feel the headache going away. If you've been massaging for like a minute or two and nothing seems to be happening, I think you've massaged long enough. If you're doing it for things like constipation, diarrhea, you can just massage. I think a 30-second massage would be very good. That's fine. And, give it a break, try the other side. So I have a list of different practitioners of acupuncture for our attendees today. So these are all physicians at NYU who also practice acupuncture and are licensed in the state of New York. So you see my name here, and these are my colleagues. We're located at various different locations. Some of us are on 30th Street on the east side. The Center for Men's Health is on Madison on the west side. And Dr. Zhang is down in Elizabeth Street. I believe she's actually in Chinatown. So these are some physicians who do acupuncture and are trained and licensed. I also have a list of acupuncturists out in the community in various places. So this list was compiled by one of my colleagues who has been working in the pain management and has been working in this area of the state for like many years. And these are all acupuncturists that he recommends. So I definitely trust his recommendations. And that's all I have for today. So we'll move on to the Q&A. So how long it takes to see relief varies from patient to patient. Some patients see the effects right away, like immediately after their first treatment, they already feel a difference. Some patients, it takes a few days for the treatment effect to kick in. So like maybe after a day or two, their first treatment, they'll start to notice a difference. Typically, in terms of the effects of acupuncture, I find that the effect is additive. So usually with additional sessions, the effects typically last longer or become more effective as the sessions go on. And in terms of how frequently people get acupuncture, that's really dependent on the practice of the acupuncturist. So in my practice personally, I'm only able to do acupuncture once a week, since that's, the only time that my office is able to kind of open up that space for me. So I do weekly acupuncture on my patients. However, if you go out to someone who's like a licensed acupuncturist in private practice, they may be recommending to do acupuncture treatment like every other day for like a week or two, or 3 times a week or twice a week. So it really varies depending on the practitioner, but it usually does take more than one treatment. So anytime is a good time to start acupuncture. In my personal experience, it's easier to control symptoms with acupuncture if we start earlier. So for example, right, there's different degrees of severity of how symptoms can get. So if we just take chemotherapy-induced peripheral neuropathy, for instance, that numbness, tingling, burning in the fingers and the feet. If we start when the patient is having mild symptoms, we see the effects of acupuncture a lot more quickly than if we start with a patient who's already having really severe symptoms, where they already feel like they can't feel anything in their fingers and feet. It's much harder to get the effects, and it takes longer and more treatments to start to see a beneficial effect. So moxa is used to kind of restore energy of the body. The theory behind moxa is supposed to be very restorative, very healing. Actually, first, let me explain what moxa is for the rest of our audience who maybe are not as familiar. So moxa is a type of herb. It's Chinese mugwort, and it can be purchased, if you go to certain herbal stores and things like that. And when it is used in acupuncture, there's a few different ways it's used. Sometimes it's placed on top of the acupuncture needle and lit up. Sometimes it comes in a stick, looks like a giant cigar, and you light it up and you kind of basically hold it over certain acupuncture points and do certain patterns, or you put needles in first and then you hold that stick of moxa and kind of circle around the needle. And the practice of moxa is really to energize the body. So moxa is thought to give that life force, that energy to the body. So for someone who's has a lot being taken out of them, for example, our cancer patients on active treatment, right? You have a lot being taken out of you. Moxa is thought to be restorative and to help increase your energy. So that's kind of when it's used. So I do not think that acupuncture helps reduce radiation-induced fibrosis. I do think it helps loosen up tight muscles, right? So those are two different things. So in radiation-induced fibrosis, just to kind of explain what that is, it's a side effect of radiation treatment. Normally our tendons, our muscles, our soft tissue, our fascia, everything's very stretchy, right? So our skin, if you feel it soft, it can stretch and it can contract. However, when radiation damage occurs to that soft tissue, instead of being able to stretch and contract, our soft tissue hardens, it becomes fragile, and it becomes stuck. And then patients start to notice tightness in those areas. And that's what radiation-induced fibrosis is. I don't think acupuncture helps with the pathology of this happening to our soft tissue as a result of radiation damage. But acupuncture can help with the muscle tightness that occurs as a downstream effect of radiation. So the whole body is like a chain. So if you have radiation-induced fibrosis in one part of your body, it pulls on everything else, right? So for example, if I have radiation-induced fibrosis in my neck, it will pull on my back muscles, it will pull on my shoulder muscles, it will pull on my chest muscles because everything is connected. And then you might end up having subsequent downstream tightness of those other muscles because you have fibrosis in one part of your body. And so I think acupuncture is helpful for that downstream tightness, but I don't think it helps with the actual fibrosis portions. So if we're talking about fibrosis of the soft tissue from radiation, things like that, any kind of stretches you can do, whether from yoga or just from regular stretches, are helpful. Because when you do anything that increases your range of motion, like yoga or stretches, you're helping stretch against that contraction of the soft tissue. So I absolutely do recommend patients who've had radiation to do regular stretches, always and forever, honestly, because with new research, we're finding out that the side effects of radiation can continue to occur even 20 years down the line. So I recommend for everyone to stretch. The biggest limiting factor to what things can be treated at the same time is where the points are physically located. So for example, certain treatments, like for this treatment for dry mouth, all of the points are on the front of the body. Certain point treatments, like for back pain, all of the points are on the back of the body. So I cannot treat dry mouth and back pain at the same time because I cannot access both the front and the back of the patient's body at the same time. But for anxiety, fatigue, and depression, that can definitely be treated from the patient lying on their back. And then that way, with access to the entire front of the body and the ears, those three conditions can definitely be treated simultaneously.
Keep an eye out for more community and survivorship webinars starting in January. We'll be hosting a 3-part breast cancer care webinar series covering the entire spectrum of breast care, including prevention, nutrition, updates and therapies, and surgical interventions, clinical trials, and more. Additionally, we will be having a survivorship webinar on neurological complications of cancer and cancer therapies on January 23rd.